isolation or PUI beds. On Monday, we had 76 beds available. Of those, 6 were in the private sector at Greenacres Hospital, and 70 were in public hospitals. Then ICU beds available on Monday were 2, with 1 being at Greenacres Hospital and 1 at the field hospital. In terms of personal protective equipment, we are well covered and currently do not lack any PPE, and PPE is monitored on a daily basis through the SVS system and is made available as and when required by facilities. The laboratory, unfortunately, still has a bit of a backlog. On the 15th, they reflected that the time from collection of the specimens to review of the specimen was 51 hours. It was, however, a bit more when I analyzed the data. They have no problem with collection materials, neither do they have any problems with reagents. They are also suffering due to staff members being away in isolation, so that puts strain on the lab as well. Then the turnaround time for the lab has been increasing progressively. They are busy clearing the backlog, so we are hoping that after today we will be back to having a less than 24-hour turnaround. Our major challenges are the non-adherence to regulations of both the community as well as the personnel, and that is reflected in the fact that so many of our staff do test positive. Our staff are starting to become very tired. It's the same team that has been working since the beginning of COVID that is still soldiering along. We do have beds available, 100 beds at Dora and Ginza Hospital that will be operational as of today. We have 73 beds here at Livingston Hospital in the basement, and we are positive that those beds will be operational before the end of this week. Then at Mpilweni Hospital, we actually treat PUIs that require hospitalization at Mpilweni Hospital, and Mpilweni has a further 80 beds available that should also be ready for occupation by the end of this week. Our casualty units has been congested as a result of the high bed occupancy in our hospitals, which actually delayed patients being admitted to wards. Then we have a problem currently in the sense that the 72-hour mental health unit at Dora and Ginza Hospital is currently an isolation site. So therefore, due to 3 patients having tested positive, so therefore we cannot admit acute mental health patients at the moment at Dora and Ginza Hospital. There is, however, a 72-hour unit at PE Provincial Hospital, but we first need to ensure that the patients test negative for COVID prior to admitting them at PE Provincial. Then our staffing for case management is currently under pressure due to the high number of cases that we currently have. Today we have 4,075 active cases that need to be monitored by the case management team. I think, Minister, I will stop there, but just to mention that we have a number of interventions that we are implementing. We are working very closely with all stakeholders, including VW, and as well as indicated, the municipality and the department works in unison. we have suspended elective surgery so that we could free up personnel to care for people needing assistance presenting with COVID symptoms and for taking care of COVID positive patients in our hospitals. Then we will be implementing, it should go live today, the bed management system, the HMS2, which is a locally based hospital management system developed by a team at Freya Hospital. We have moved an emergency medical services vehicle to every single hospital in the public sector that deals with COVID so that we could speed up the transportation of COVID positive patients between facilities. And then we are grateful to the South African Police Service, who works very closely with us, and they escort our ward-based primary healthcare outreach teams that does tracing and testing, specifically in the KwaZulu and New Brighton area that is rife with crime. Then there is intensified compliance monitoring that is taking place, and we are also very grateful to Médecins Sans Frontières, who have graciously sent us 2 medical officers and 4 professional nurses to assist us in this fight against COVID. And then we have deployed Cuban doctors from Chris Hani and from Alfred and Zo to come and assist in the metro. Thank you. Shane will just continue with the public health portion of the presentation.
Thank you, Dolly. As I said, I will go through the non-medical part fairly quickly, but our public health, they monitor the funerals, the deaths in terms of, and I've just captured for the last 3 days where they monitored COVID funerals deaths on the 11th, 12th and 13th of November. The epidemiological surveillance, 5th, 6th, 7th, 9th, 10th and 11th November, that is an ongoing process that we are hoping to up our interventions in that regard. Case and support service to older persons. This is from Department of Social Development. The post office interventions, because one of the issues around the post office with the long queues of the post offices, people are non-compliance around that area. So we put the onus on the post office to say, what are you doing about it and how are you going to fix it? They've also had a number of active cases and also not immune to crime along the way as well. Unfortunately, they're also battling, from what they've informed the JOC, in terms of queue busters or queue walkers, to inform residents they are setting in queues to get their grants, that they need to practice social distancing and wear a mask. We've noticed it's an area, we've asked our Metro Police and SAPS when they're in those areas just to explain to the people sitting in those queues that they need to have social distancing and they need to be wearing masks. Following post offices are also closed on a regular basis because of COVID, as well as, unfortunately, robberies. St. Albans Prison, this is a little bit old. They currently have 10 active cases at St. Albans Prison. Of all those 10 are the staff members. There are no prisoners currently infected with COVID, which we are very thankful for at the moment. That's what I've already just said. SAPS, also an important member of our JOC. It's just a deployment processes over the last, from the 15th of November to the 16th of November. One will note that SANDF are no longer part of the deployment process, but we've got your visible policing, Metro Police, Metro Traffic and Provincial Traffic. We also have no one at this moment in time, but we do have a Metro Traffic service. Total operations, those are the operations that took place. Ongoing operations, liquor premises that were visited, all, none were closed, they were all compliant. COVID cases that are reported and investigated. The cases per day, as you can see, there was a significant drop, and now in November there's once again an increase. Unfortunately, also not immune to burglaries around COVID. There seems to be a massive increase in crime post-COVID. And schools been impacted on, churches also been impacted on in the process. Liquor premises, drinking liquor in public, there were 19 cases, and selling liquor outside of the hours. COVID cases, burglary, business and liquor, those were going into the detail. Our law enforcement agents within the Metro Police also clamped down and active on taverns and nightclubs that are not allowed, people are trying to stretch it, and they've actually closed down a number of places that were way in excess of what they need to comply, and criminal charges were laid against them after they've been warned. So that's an active case, it's an ongoing process, and Metro Police and SAPS are working together on that process. So over the last week, there were 49 visits and 49 interventions taking place there. And Department of Employment and Labour, a very important component of ours because they do the compliance inspections. Again, it's just a reminder that employers are compelled to report all COVID cases to the Department of Labour. They've also got compliance inspectors, and when we get cases of businesses and organisations non-compliant, we give it to Department of Labour, who have the ability and authority to close down a premises until they become compliant. We've noted this is one of the areas of major concern in our city. So university, nature of their challenge is basically social is not insular from society. One tends to forget that the Nelson Mandela University is a combination of previous Technikon, UPE and Vista University. So our university spreads over the entire city and has literally thousands of students. So the impact on this process, and what's concerning is at the moment they're all writing exams, and we see that partying increasing. One can only imagine what is going to happen after exams, and I'm going to include the matrics on that. I've already seen adverts going out for matric rave parties and so forth, which are all potential massive spreaders as we go forward. As Darlene has already said, the university has got very good intervention processes taking place, off campus, on campus, private accommodation and homes. The integrated response. Again, university is also an important part of our Joint Operations Centre, and the detail that they give, and it's way more than just the reporting, the assistance that they give us as well as the Department of Health in the process is very much appreciated. Their promotion and prevention strategy, and this is the strategy that we are all trying to follow because it is about promotion and it's prevention. Department of Education, that's the schools. We are quite satisfied with what they're doing at the schools. However, we do note that there is an increase in infections in the schools taking place. But the schools are all generally very strict of what goes on in the school. It's a problem that goes on after school, where we even noticed when they were having their valedictories in the school year for the matrics, I personally saw matric students walking along the beachfront carrying bottles of champagne and so forth. There was no social distancing whatsoever, and they were warned to stop on that process as well. And I'm talking about elite schools here, not just any schools, who should have known way better. Candidates testing positive, they've got a process in place for any candidates testing positive and special circumstances for them. They've also mentioned the important process of psychosocial support for schools and teachers, with many teachers being infected, and some schools, one of the schools actually lost its principal and deputy principal in a week from COVID. Disruption of schools, obviously COVID-19, I said it in one of the joint operation centres in the beginning of the year. Unfortunately, 2020 is possibly a year we would all like to forget. In some ways it's a lost year, but we've got to keep on fighting in this process. So there's been an ongoing disruption of schools. I've spoken to some of the principals, for instance, and they've also mentioned especially the grade 8s have really been struggling this year because there's a big step between grade 7 and 8, and because of interruptions, they've really been struggling. The school disruptions as a result of that, as I said, schools are frequently closed, classes are closed as a result of infections taking place. Human resources, schools are no different from Department of Health. They've also got a massive shortage of human resources, simply because some teachers are obviously COVID positive, some have passed away, and some have got high comorbidities and cannot be at school. So they have serious disruptions around those areas. The Nelson Mandela municipality itself is not immune to COVID. We've had a number of deaths, a number of infections, and closing of departments on a daily basis. So we've got a return to work plan, we've got a return to work strategy. We're trying to break up our working groups a little bit so we can continue to provide services to the metro. It doesn't make much sense to have everybody at work at the same time and we have an outbreak and then we close down essential services. So those processes are also not underway, they are being implemented as I speak. That's our COVID positive cases. In the past week alone, it was rather frightening that there were 15 cases in a week in the municipality. And those were the reported cases. Quite often there are no cases not reported as well, and people just remain at home. Non-compliance, I did share a photo earlier on. The one is a place in Motherwell called Kwakkoke. The other one is a school in Uitenhage, near Matrix, celebrating a valedictory. As you can see, absolutely zero social distancing taking place. General comments, staffing at hospitals not adequate, exhaustion of staff. That is not only for the hospital staff, emergency services staff. We've all been battling with the same process. The staff that we've had to rely on for the last 7-8 months are the same people that are still standing today, and I think we've got to take our hats off to all of those people. The festive season that's coming, I say festive season stroke Christmas, it's an area of concern in that, and this is the message that we're putting out there as well, that the festive season, if we don't stop this process now and we don't all get the community complying to the compliance processes, we are going to be indeed in for a festive season that we'd rather forget than remember. And it's really up to all of us. Non-compliance with the curfew, it's almost as if everybody's forgotten. We've spoken about shebeens and processes like that. However, it's the informal functions that are also concerning. Over the weekend, I think Darlene also took a drive past some of our well-known braai areas along the beachfront. They were literally packed. But what was concerning, obviously when groups of people are braaiing together, they open a quart of beer, and there goes the beer being shared amongst everybody, and there's a cigarette being shared amongst everybody. So once again, I must admit, my minister from Cocta was perfectly right about the alcohol and the cigarettes in the process, because there was a reason behind it. We don't know how to behave when it comes to processes like that. Non-compliance of entertainment and retail, we've started processes in actively engaging them on how to comply. We've engaged our business chamber, but we're also speaking to tavern owners, as Darlene's already mentioned. We're going to have active going into the wards, speaking to the taverns, explaining to them about compliance, because it's in their hands. What we've told them is, would they rather be shut down again completely or comply and continue to operate with COVID around? We need to learn how to work with COVID. Wearing a mask has not been adhered to. Increase in alcohol-related incidents. There's no doubt that there's been a massive increase in alcohol-related incidents, not just COVID, but motor accidents and so forth. It's, even the abuse that we've picked up that's been taken as a result of alcohol. Crime, there's been a huge increase in crime, and it doesn't just affect you and I, it in fact affects our hospitals as well. Dora Mkhize last week had to, part of Dora Mkhize could not operate because somebody had tampered with one of our substations to steal parts, and that took out part of Dora Mkhize hospital. Increased vandalism, I've spoken about that, and the post office queues we must not forget about. The way forward, how do we reduce the curve? And these are things that came from the JOC meeting, health interventions, which Darlene has spoken, aggressive communications. I think maybe our communications has been a little bit too nice. We need to be way more aggressive in how we communicate. Daily reporting of COVID cases. We need to tell everybody how many people have been COVID positive and go down to almost to the wards and say, this ward is now a hotspot, and warn people so people are aware. Mask wearing, encourage all, and it's more than just encouragement. We know it's mandatory, but remember, mask wearing is not a criminal offence. However, if I go into a shop or into a business and I'm not wearing a mask, that shop or business can be shut down for non-compliance. There is a directive as regards that. And the sanitizing. I know we are a water scarcity. We have actually got a water crisis at the moment, but we need to sanitize all the time. Enforcement of level 1 regulations, which between SAPS, our traffic services and Metro Police services, we are actively engaging on how to further improve on that. Bylaw enforcement, we're looking at how we can improve on our bylaw enforcement and use the current bylaws to use as far as COVID goes. And when I say that, cutting down the places, maybe operating hours, places where people can go to, and then the finally is to make it everybody's responsibility. We can no longer say it's a policing responsibility or it's a Department of Health responsibility. It's an all of ours responsibility. It's a collective responsibility, and that's where we have to go. Thank you very much.
Yes, that's one. And this one.
Honorable Minister, MEC, let me say protocol observed. Oh, okay.
This is Eunice.
My challenge, Honorable Minister, I didn't eat too many things. And my father is the cause of this. Because my mother was taller than my father, so he's the cause of this. I'll try so that I can see everybody. Oh, give me my, okay. Okay. Let me say that we are humbled to have the World Health Organization with us. Honorable Minister and MEC, I was saying that we are a vast area, as Sarah Batman, which is about 60,000 square kilometer radius, 7 local municipalities. But in numbers, we are less. So starting, that is the report that we are submitting today. This is the testing that we are having. As I said, that we have our 7 local municipalities, which is Blue Crane, Dr. Beyers-Naudé. Dr. Beyers-Naudé is the amalgamation of 3 local municipalities since the 2016 elections. Then we have Koga, Kukama, Makana, Ndlambe, and Sandys River Valley. So these are the states that we are having. I'm trying now to work on time. But these are the states that we are having, of which when we note the positive tests, the cases, for Blue Crane it is 5.38. For Beyers-Naudé it is 5.39. For Koga it is 3.50. For Kogama it is 5.24. For that is Koga, that is Makana. Kogama, sorry, we have 3.51. No. For Kogama, we have 5.24. For Makana, we have 3.51. For Ndlambe, we have 3.00. And for Sandys River, we have 4.29, which gives us as a district a total of 4.14. But we must say that since we started, we have noted some results that are not so good with us. Okay. The testings, those are the testings that we have, of which the new tests in the 7 local municipalities, they give us a total of 2,171. And the new positive tests are 460. This is a high jump because just a week back, the number was lesser than that. And then the new detection rates, it's 21, which is a worrying factor. And the new test in the entire total, it's 2,865. And the new detection rate, it's 32%. As Sarah Bartman, the entire district, since we started from the 1st of March, the total number of COVID-19 tests done is 50,672. And out of that, the positive cases are 10,625, which is the 21% that I was saying is a worrying factor to us. And the recovered cases is 9,244, which gives us 87%. Some time back, we were clapping hands because we had 94%, but now again, we are coming back to that percentage, which is lower than what we expected. And those that we say that they are active cases is 1,090. Minister, what is worrying here? Just on Monday, we had 900 and something. So every day our numbers are shooting up. Last week Thursday, I think we had about 400 and something. So there is something wrong of which we need to apply our minds as to how then we fight it. Our deaths are not shooting up as the infection cases are shooting up. Our death cases are 291. And then when we come to the epidemiology, now, my tongue must guide me. This is the case with us. We are one of the districts that are hotspots when it comes to COVID-19. As we can see there, those yellow ones, it's where our threat is, where we say that we need to work more closely, supporting each other in order to reduce those numbers. The incidences on mortality prevalence per 100,000 of the population. That is the number that we are having. Blue Crane, as I said, that our numbers are not as big as our area is vast. That is the total number for the entire district out of the 7 local municipalities, and our active cases are, the percentage is as it is. That is the graph from the 25th of March up to the 25th of October. So the escalation, we thought that would manage the curve. When we started, it was fine. But rather than the reduction, we see a serious increase within the district. So that is the average that has been confirmed. And the epidemic curve, that is the one that I say, we thought we are managing it, we were doing well, but now it is as it is. But I must say, Honorable Minister and MEC, I hope it will be covered some way, because I'm coming from quarantine also, so I could not get to each and everything. The challenge that we as we see how it is moving, it has many factors, of which as time comes, I will talk to that one. Here are our hotspots. If we see in the entire 7 local municipalities, we see red. It's there and there that there is a managing that is taking place, but currently that is how we are. That is why I was saying it is a worrying factor. As a result, tomorrow afternoon we'll be having a visual meeting with all ward councillors and mayors with the Department of Health to discuss this issue. The contact tracing is taking place in each and every municipality. So this is how the performance of the contact tracing is taking place. We can pass that one. The contact tracing on COVID-19 contact, the index is 93.6 The contact tracing is 91.9. We have that 2% that we are looking at. The contacts untraceable is 6%. And tested for COVID-19, it's 98.4. Yet the contact testing positive is 13.7. We are challenged whereby now we see children are also attracting the pandemic or the virus, of which that is the stats that we are having from 0 to 4 years up to the children, up to the overall cases on learners that are also at school. We've noted in the past week many primary schools have closed, high schools have closed, but they reopened on Monday. So we are facing those challenges. The total cases was 10,625 and recovered it's 1,305, of which the active cases is 161. But no deaths have been reported when it comes to children. Current quarantine and isolation, those are the areas that we are having, of which we are still engaging on some areas in spaces that are not being used. So those are the quarantine areas that, as well as for isolation. The challenge we are facing, Minister and MEC, we have more reliance to the metro also. Because when numbers are increasing and it's full in our area, we must contact the metro so that we can be accommodated. That was a good relationship, but we are to see as we move further, as the stadium now is open for its own purpose. So non-health facility, we have that 52. Hospital, including the PUIs, it's 106. And those that are always negotiated with to be at home, it's 932. So the actual total is 1,090. On hospital activity, you were supposed to talk on it.